Assalamu alaikum everyone. The next topic of discussion in RBC disorder is G6PD, which is glucose 6-phosphate dehydrogenase deficiency. It's also known as flavism. Epidemiology. So G6PD deficiency is the most common enzyme deficiency, and it mainly affects the males, African, Mediterranean, and Asian descents. In pathophysiology, it's an X-linked recessive inheritance, so it mainly affects male. G6PD is the rate-limiting enzyme of the pentose phosphate pathway, also known as hexose monophosphate shunt. This pathway yields NADPH, which is essential for converting oxidized glutathione back to its reduced form. The reduced glutathione is capable of neutralizing reactive oxygen species and free radicals, and therefore protecting RBC from the oxidative damage. In the absence of reduced glutathione due to G6PD deficiency, RBC become more susceptible to oxidative stress that can damage erythrocyte membrane, resulting in intravascular and extravascular hemolysis. Here are the redox reaction, the reduction and oxidations. In these reactions, the glutathione detoxifies usually free radicals and peroxide. Here the peroxide is H2O2. So glutathione oxidizes the H2O2 into water and is converted into oxidized form. So reduced glutathione is converted into oxidized glutathione and convert H2O2 hydrogen peroxide to water, preventing the cell from the oxidative stress or free radical reaction through the enzyme glutathione peroxidase. Now the reduced oxidized glutathione is converted back into reduced glutathione through glutathione reductase enzyme, which required NADPH for its conversion. So here are we have a lot of pathways where NADPH is generated, but the important one is we have hexose monophosphate shunt or pentose phosphate pathway, in which glucose 6-phosphate is converted into 6-phosphogluconate by glucose 6-phosphate dehydrogenase, and NADP is converted into NADPH. So this cycle continue. The reduced glutathione is converted back to oxidized and converts the H2O2 into water, and again oxidized glutathione is converted back to reduced form by NADPH, which is generated in this pathway. Causes of increased oxidative stresses are fava beans, drugs like anti-malaria drugs, sulfur drugs, nitrofurantine, isoniazid, dapsone, NSAID, ciprofloxacin, and chloramphenicol. Bacterial and viral infections are the most common causes. Severe enzymatic deficiency can inhibit respiratory burst activity due to reduced NADPH production in phagocytes. Inflammations. During inflammatory reaction, free radicals are produced and can diffuse into RBC, and metabolic acidosis. So these are all the causes of stresses. Clinical features of most patients are asymptomatic. Recurring hemolytic crisis may occur especially following the triggers. Arise within 2 to 3 days after increased stress, sudden onset of abdominal or back pain, neonatal jaundice, dark urine, and transient splenomegaly. Recurrent severe infection causing symptom of chronic granulomatous disease. Diagnosis, so we can do blood smear. So on the smear we will find His bodies, which are the hemoglobin inclusions within the erythrocytes due to hemoglobin denaturation. Then we have bite cells. These are due to macrophage, which remove the denatured hemoglobin inclusion of RBC. There will be sign of intravascular hemolysis like normocytic anemia, increased retic count, increase unconjugated bilirubin, increased LDH, decreased heptoglobin, and hemoglobinuria, as it is the type of hemolytic anemia, and it's a type of non-immune mediated, which is due to intrinsic defect like enzyme deficiency in the RBC. So there will be the signs of hemolysis and normocytic anemia. Screening test, fluorescent spot test is used. Add glucose 6-phosphate and NADPH. Measure NADPH fluorescence. Normal G6PD activity produces fluorescent NADPH. NADP is converted to NADPH, while in G6PD deficiency, a lack of fluorescence is seen. It's a semi-quantitative test. Confirmatory test is quantitative G6PD enzyme level. So this is the confirmatory test. Ideally, both screening and confirmatory tests should be performed during remission. Stress make me want bite into some Heinz ketchup. Stress, so increase oxidative stress. Bite, so bite cells, and Heinz ketchup, so Heinz bodies. These will be the finding on the smear. These are the hinge bodies seen on the smear, and these are the bite cells. Now what's the treatment? So avoid triggers, and blood transfusion should be performed only in rare cases. So mainly avoid triggers in cases of G6PD. Selective advantage in area of endemic malaria. As with sickle cell, carriers of G6PD may be less severely affected by malaria, especially if the disease is caused by Plasmodium falciparum. So that's all about G6PD.